Guys, it's Melanie. Wanted to visit with you today about resources. Now, when you first hear the word resource, I know many of you think immediately about money. And yes, money is indeed a resource. But I'm going to visit with you a little bit today about exactly what resources are for us here at Linn County Hospital and want you to think about it in a little different perspective. Resources can be known as time, money, energy, materials, but resources can also be known as people, relationships, skills, habits. These resources that we have, you can break them down between external, which are exactly that, and they exist outside of yourself. Books, buildings, computers, your relationships with professional peers, your peers and um, colleagues here at work. Internal resources, internal resources are things like knowledge, quality, habits, skills. So I think for any successful organization, you have to have a balance of external and internal. But not only do you have to have those different types of resources, you have to have what we call acquired and required resources. Acquired resources are exactly that, the ones we already have that are allowing us to be successful. And then required are the ones that are essentially that must be present for us to either be more successful or to continue to be successful. So when you think about some of those definitions and descriptions I've given you with regards to resources, and you do today's survey, I want you to think and use those as some of your filters. The first question we're going to ask you is how does your department manage resources? So use some of those filters when you consider that point. How can you help your department manage resources? And then lastly, as an organization, what's one way your department or LCHD can improve the use of our resources? So think about that. We want your input with regards to how LCHD uses and can better use our current resources. Thanks. Stay safe. And as always, our vision, healthcare closer to home.